Okay, we started. So whenever you're ready to start.
Okay, thank you. Good morning, good afternoon, good evening, everyone, and welcome to the global meetup on Washfit, which is convened by WHO and UNICEF. I'm John Brogan. I work with Helvetas in Zurich, Switzerland, and I'm a WASH advisor. And I also do technical backstopping to the Swiss Water and Sanitation Consortium on WASH and healthcare facility projects. When Washfit was launched in 2017 in Kathmandu at the Global WASH and Healthcare Facilities Conference, our community of practice was just beginning. And since then, so much has been happening. So if you're joining us today, it's because you're a part of the achievements of what's been happening through Washfit. And we'll hear more about those achievements a little bit later. You may also be joining because you're keen to know what's next with Washfit and the highly anticipated update, Washfit 2.0. There's a revision process for Washfit, which is ongoing, and we'll tell you all about that and also how you can get more involved. We're going to also hear from Julie Storr from WHO about a new Washfit training manual, which is specifically geared for trainers and can really enhance the experience of Washfit in the field. We have a few other speakers lined up today who are going to share their experience about Washfit, about what difference it made in their programming. With our tight schedule, we've asked the speakers to stay to 5 minutes intervention so that we can have time for questions and answers and reflections from the variety of participants today toward the end. So if at any point during the meeting you have questions on what's being said or anything else having to do with Washfit, don't hesitate, use the chat box, put your reflections and questions in there, and we'll be noting them down and we'll be addressing them as much as we can. We don't yet have a formal Washfit community of practice, but we're really pleased to see everyone joining this meetup today, and we could envisage that it becomes a periodic meeting. So we can share our learning and our experience, you know, things like who's using Washfit, where, how, what's been the difference, what did we learn from it, any publications, these kinds of things going together would be great to construct a community of practice. So potentially something like that could happen. Also during this meeting, if you have ideas or reflections about what this community of practice could look like, what would be the interesting topics that we could treat, what would be, you know, kinds of tools or inputs that you would like to see from us in these kinds of meetings, please drop that also in the chat room. So while we're speaking of the chat box, please introduce yourselves, your name, where you're joining us from today, the organization you work with, and your position. And with that, I'm really pleased to introduce to Arabella Hayter, who's been leading all things Washfit since, I don't know, Arabella, I was trying to figure it out since about 2016, maybe before. Can you give us a quick overview on Washfit and where it's been used so far?
Thanks, John, and welcome everybody to today's webinar. Thank you for everyone for joining early in the morning for some and late in the evening for others. So we appreciate you taking the time to join us today. And please, as John said, do introduce yourself in the chat box, and we hope to have a rich conversation today. So today's webinar or meetup does assume a basic understanding or knowledge of Washfit already. I see very many familiar names joining us who I think already are familiar with the tool, but very, very quickly, for those of you who are new to Washfit, here on the screen, you should see the main Washfit schematic. So the white circle you see in the middle is the 5 Washfit steps. So the circular process that facilities undertake to improve their WASH services. And the outcomes and expected impacts of Washfit is ultimately, the aim is to improve quality of care. So quality of care for mothers, for newborns, for other members of the community, to improve outbreak response and resilience, which of course is incredibly important in the current COVID-19 climate. Washfit, as John mentioned, it started, it's been going for a few years now. The first countries to use Washfit were Mali and Chad in 2015. And since then, we've seen demand and interest in the tool really grow. And it's fantastic to hear about numerous partners, organizations, countries who are using it around the world. So we have currently 40 countries and counting, and these countries listed here have used Washfit to a greater and lesser degree. Some of them have done small pilots in just a few countries. Others have done much larger scale, even national efforts on Washfit. And I'm sure many of you joining today are representing some of these countries. So please do share your experience in the chat box. We'd love to hear from you about how you've used Washfit to date. So just want to highlight a few recent Washfit updates. And this is, of course, just a very small snapshot. And you'll see through the new package and the new materials that we're launching, there's going to be more case studies, information shared on the experience of countries. So recently, Niger launched Washfit officially. The Ministry of Health launched it as the national approach, ensuring more coordination by partners. So there's a number of partners already using Washfit in the country, and now by the Ministry of Health launching it as the national approach, it's really harmonizing those efforts and making sure that all partners are using the same version. In Laos, a country that's been using Washfit since 2017, they have integrated Washfit with a national climate resilience program called the Safe and Green Climate Facilities, and have managed to mobilize over $2 million of funding to help scale up and implement Washfit. In Venezuela, a country which is undergoing a protracted emergency situation, which of course has specific challenges for WASH infrastructure and services, UNICEF have been implementing Washfit in 200 facilities, and through the assessments they've conducted in the Washfit cycle, have identified innovative solutions. So they've installed saline electrochlorinators, and the effect of using Washfit in these facilities has enabled better data sharing between partners and with the government as a result of the data collected through Washfit. And then in Mali, a country which has been using, as I said, one of the original countries to start with Washfit, there was a nice example recently, and there's a picture in the bottom right-hand corner of the Washfit committee in question. The Community Facility Management Committee, who managed the healthcare facility, mobilized funds, materials, and labours to construct toilet blocks to end open defecation practices at the facility. And this was identified through the Washfit process and with the strong involvement of the community. So I think we're due to have some experience sharing from a couple of countries, and I'm just scanning the participant list to see if our colleagues are online. So Woltaji, if you're online, hopefully you're able to raise a hand or let us know you're there. Woltaji. I'm not sure if Woltaji's online yet, so maybe we'll see if Elmira from the Philippines is online, who's also due to share her experiences, although I'm not sure, scanning the list, that I see Elmira either. If not, John, I'll pass back to you.
Thanks, Arabella. So we'll just then zoom in on some very brief experiences from implementing partners of the Swiss Water and Sanitation Consortium. So first, I'd like to go to Noor Siddiqui. You're working with Swiss Church Aid, with HEX, in dozens of healthcare facilities that are serving displaced populations in Cox's Bazar in Bangladesh. And I'm wondering, could you share your experience of how Washfit has added value to your emergency interventions? Siddiqui, I thought I saw you on. Are you able to?
Hello, John.
Excellent. Yes, go ahead.
Yeah, sorry for the delay. Okay, thanks a lot for inviting me to share our experience of implementing Washfit in Cox's Bazar. So I would like to mention actually few things to highlight our experience. First of all, the Washfit approach is very much aligned with the government strategy in Bangladesh, because in 2019, with technical support from UNICEF, government has like prepared one strategic guideline for wash in healthcare facility. And Washfit, so far in our experience, we have seen that it's more or less aligned with like the government approach. And the second thing is, without Washfit approach, it wouldn't be possible to achieve the milestones we have achieved so far in Cox's Bazar. Because after COVID-19 hits Bangladesh, the importance of WASH and IPC related measures have been felt, I would say, strongly in order to build a resilient health systems. And WashFit has enabled us to design, implement, and document in a more structured way. And the third thing is, our approach of implementing WashFit is more participatory. As a result, it does not only inform us about the gaps, current status of challenges, but also informs other interested parties and healthcare providers as well from any certain facility to realize their whereabouts against a standard water sanitation, hygiene, and IPC practice. Basically, WashFit has helped to bring down everything in line so that we can think and work to achieve the similar goals. And finally, I must mention that we included one hardware component later in our Washfit program. And this blend of both hardware and software components have profoundly impacted the health facility and healthcare providers towards a health care provision. And I'm sorry, I did not introduce myself. I forgot that. This is Siddiqui. I'm working with HexSeeper in Cox's Bazar as a project manager health, and I'm also the focal point of Washfit in our organization. So thank you, John.
Thank you very much, Siddiqui. That's excellent. It's great to see how Washfit has enabled infection prevention and control processes to find better expression in the day-to-day operations of those facilities that you work in. Thank you very much. I'd like to stay in the South Asia region over to Nepal for Prakash. Prakash, using Washfit, has it made a difference?
Thank you. Thank you, John. Thank you, John, and WHO for providing me this opportunity to share about today's experiences from Washfit implementation in Nepal. Hello, everyone. This is Prakash. I'm the Health and Wash Program Coordinator for Terdejom Foundation based in Nepal. So Terdejom has been active in Nepal since 1985, and our major programmatic areas of intervention are child protection, mother and child health, and water sanitation and hygiene. And TDH in Nepal is a part of Swiss Water and Sanitation Consortium. Has been working in 8 primary healthcare facilities of Bardia district since April 2020. And we have been using Washfit. As per our experience, this tool has been very useful to improve wash status of healthcare facilities. And in Nepal, when we started in Washfit in 8 healthcare facilities, the project management committees of these 8 healthcare facilities did not have a clear list of wash issues needing improvement, and SCF personnel lacked strong argument to highlight wash need with the local government. At that time, the project supported to train the Washfit team to assess the condition and prepare an improvement plan following the Washfit methodology. All the SCF have now wash improvement plan, and the SCF manager are encouraged to refer to their wash improvement plan when requesting fund with the municipalities. Most importantly, 3 SCF have already obtained a good amount of resources for their priority action in their action plan. For example, one of the SCF called for staff capacity building on water quality testing, when a representative from Washfit team shared a copy of their wash improvement plan, and then municipality quickly responded by conducting a training for the healthcare facility personnel, and provided a set of water quality test kit to that particular healthcare facility. Similarly, having involved the municipal health coordinator, health and wash coordinator in Washfit training, we have also noticed that these coordinator began asking about the progress of Washfit implementation during their monthly meeting with the health facility managers, valuing the Washfit and implementation, which wasn't the case before. Basically, the MNE is very weak actually around wash in Nepal. So I think this tool has been very good, useful to improve that system as well. Although the SCF are entitled to receive the health management fund in Nepal, some small amount of money, some are yet to access to it due to lack of information, frequent turnover of staff, and in some cases lack of intent. But the integration of our Washfit in the municipal planning process stands such gaps. So I stopped basically my experience sharing here, saying that if we hadn't done Washfit process, I think this would not have been possible. The achievement that we have gained so far from the implementation, from the introduction of this tool. So thank you very much.
Thank you very much, Prakash. It's great to see how the Washfit plan, when it comes out, is a tool which is taken very seriously. It can lead to resources and action from local authorities and officials. Fantastic. I'm sure there's many more stories like that from those who are here online. If you'd like to share those in the chat room, please don't hesitate. Arabella, shall we continue with an update on what are the updates for Washfit?
Absolutely, and thank you to both Prakash and Siddiqui for those interventions. And as John said, do continue to share your experiences in the chat box. We'd love to hear more. So one of the main purposes of today's session was to provide the global community of practice with an update of what we at WHO and UNICEF have been working on over the past year. So there's a number of new and updated products that we're pleased to be able to share soon. And at the end of the session today, we'll let you know the timeline for these various products and how you can get involved. So the main things that we are updating, the first is the Washfit guide that was published in 2018, which you may recognize that picture in the top right-hand corner on the cover of that 2018 guide. We also have a new version of the Washfit assessment form, a series of technical fact sheets, a new training manual, which my colleague Julie is going to talk about in due course. And also we're going to be collecting more information on implementation and doing so in a more structured way. And again, I'll explain how you can contribute to that process. And also we're in the process of developing a Washfit app. So firstly, what are the main updates to the new guide? So the guide is being updated based on our experience that we've learned from the last few years of implementation, that we've heard what works and what doesn't work, where extra guidance was needed. So the new guide will include information on how you do those national level preparations for Washfit. So although Washfit is a facility level implementation tool, we are now including more guidance on what you need to do at the national level in order to prepare for the facility level implementation. So what are the resources needed, the financial resources, technical, political resources, what other training you need and preparation in order to make the most success out of Washfit possible. We also had requests to include more guidance on a number of topics. So on gender equity, disability and social inclusion, or GEDSI is the acronym, on climate resilience, of which is an increasing problem in many countries of the world and which should really be a central a central priority for any improvements that are made to WASH services. So climate resilience, including things like water storage, water reuse, drainage and flood proofing, how facilities can deal with extreme weather events, but also green strategies, so to try and minimize the impact of facilities on the environment. Also, more guidance on safely managed sanitation and emergency preparedness. And in order to support facilities to address these different issues, there are new indicators which have been integrated into the Washfit assessment tool. And those allow facilities to monitor and track improvements and progress over time in those particular areas. So the new assessment form is in 3 new formats, or it will be available in 3 new formats. So previously there was just one version in the PDF version in the guide, which was not particularly user-friendly. So we now have an Excel version, which allows users to adapt the assessment tool to their needs, which is one of the most important parts of the Washfit process, is making sure that the tools are applicable to the local context. So the Excel version allows you to add indicators, to remove indicators, to change the scoring criteria, to add more explanatory notes, and also to translate it into applicable local languages. Currently, there is a simplified version of the Washfit assessment tool available on Kobo Toolbox, and that work was led by Food for the Hungry. And I think we have some colleagues from Food for the Hungry online today. We are looking to put the whole set of Washfit indicators onto Kobo Toolbox, because we've heard of numerous organizations who use it already and have indicated that they would find it useful to have the full set available in an online mobile version. We're also in the process of developing a Washfit mobile app, and that will also allow real-time input of data and data tracking, data sharing amongst partners and people who are working to support healthcare facilities. So those different versions of the Washfit tool will be coming soon, and hopefully will make the process a little bit more straightforward. One of the big questions that we often have received about Washfit, and what the original guide didn't adequately cover, is, okay, so you've done your assessment and you've identified a number of problems, but the most important part of Washfit is taking action and making improvements. That's why it's called the Washfit tool, the Facility Improvement Tool. And we realized that in a number of areas, we needed to include more straightforward guidance on simple, low-cost improvements that facilities could make. So for those facilities, for example, who are particularly interested in climate resilient facilities, what are the top 10 simple, low-cost improvements that a facility can make to address those problems? So we'll be developing 5 technical fact sheets, which will be an annex to the main Washfit guide, but will also be available as standalone resources that can be used. Those will cover climate resilience, safe plumbing, green waste technologies, hand hygiene multimodal strategy, and then gender equity, disability, and social inclusion. And each of those fact sheets will cover the adaptations that needed to be made to the Washfit process. So, for example, in the context of gender and equity, including better gender balance on the Washfit team, consulting with local disabled people's organizations or locals women's group, those sorts of considerations that maybe you need to do the Washfit methodology slightly differently if you have an interest in one of these areas. Which are the indicators that you should focus on? So in that new Excel assessment form, there are, I think, over 65 indicators. And of course, not all of those indicators are relevant for every facility in every context. So if you've got a particular interest in any one of these 5 topics, which are the indicators that you really need to make sure that you're assessing, that you're monitoring, and that you're improving over time? Also, what external expertise should you involve? So perhaps if it's climate, you need to involve climate experts, or if it's in plumbing, then you need to involve national and local plumbers who can support you. So what other expertise should you bring in to support Washfit? And then, as I mentioned, what are the top 10 simple, low-cost improvements that you can make in your facility? Okay, so with that, I'll pass, I think, over directly to my colleague Julie, who's going to talk us through the new training manual. So Julie, over to you.
That's great. Thank you, Arabella, and hello, everybody. So if we can move on to the next slide. For the next few moments, we're going to focus on this new training manual and specifically center around 3 questions: why a user manual is being developed, what's inside the manual, and how it might support day-to-day improvements. So if we can move on to the next slide, I'm going to jump straight in. So as we saw on that last slide that Arabella presented, the visual shows the Washfit guide at the center of this suite of resources. And the Washfit Guide 2.0 essentially is it. That's what anyone interested in improving wash in a facility will usually start with. And as you work through the guide and start to think about your own situation, especially during step 2 of that cycle, you'll be thinking about what you need to train people on, who you need to train, how you might develop and then execute your training plan, and how you might evaluate it. And so this new training manual is a user manual for use by you, the trainers, the people who will be delivering the training, but also others who will be involved in supporting delivery. And this may include people preparing training courses at the national level, at the health facility level. So in short, it will be one of the suite of resources, and a critical one at that, focused on the training element addressed within Washfit 2.0 practical guide. And it's about empowering people who want to go forward with Washfit training. And really, if you are advanced in that journey, it should still add value. If you're a novice at the beginning of the journey, it certainly will be a critical resource. Next slide. So going into a little bit more detail now, for users, what the manual does is essentially it brings together in one place all the materials you need for training. So a lot of this is not new content, it's just about packaging and in a way that is user-friendly. And this therefore will include background documents, needs assessments, the modules themselves, evaluation approaches. And the aim is to really speed up the journey, providing tips and real-world examples and making available sample resources to prevent wheel reinvention, an important part of improvement. And it aims to build in trainers the capacity to help to prepare and deliver Washfit training according to WHO and UNICEF norms and standards. And on the screen, you can see a sample of some of the modules, and some of you may have used these modules. And there are 9 of them now, which will cover wash links with health, adopting the methodology, hand hygiene in the context of wash in healthcare, sanitation, water, waste management, climate resilience, environmental cleaning, and country examples of implementation. And some of these are highlighted on the screen, not all of the modules, but they are in the form of PowerPoint slides, so a slide deck for each module, but they'll now come with a lot more to support the actual delivery, and they'll come with speaker notes, with exercises, and I'll come on to that in a moment. But essentially, what you'll receive through this pack is all of the actions and activities that will support you to be ready to implement your training. So not just the modules, but focusing on the modules themselves. The manual gives you, as you can see in this table that's copy pasted from the manual, you get an overview of each of the 9 modules, an outline of all of the prep that's needed, all of the resources, the materials and approaches that can be used when delivering each of those modules. And these modules can be delivered together or in isolation. So if we move on to the next slide, and just really focusing a little bit more on the added value that this manual aims to bring to you, So based on feedback and lessons learned, some of which Arabella has shared and some of which we've heard from our colleagues, when delivering Washfit training, we know that preparing is and can be daunting, even if you're very familiar with the technical topic, and running training workshops involves logistics and access to people, to resources, many practical things, as well as getting the technical content right. And as trainers, we want participants to walk away with all the information, the skills, the competence they need to act and to improve. And the manual essentially, very simplistically, is a resource to support this. And so you'll see on the screen some examples of what will be in that short manual. It prompts you to consider some key questions, a list of considerations to be addressed as you prepare, including running face-to-face and virtual training, and addressing the resources that are required, the funding, the adaptations, including translation, which I know has come up in the chat. And it provides a list of action checks to support decision-making on the best approach to take to, again, empower you to deliver an excellent, effective training package. It also provides example templates, assessment tools, training agendas, examples of training approaches from different countries, some of which we're hearing about today, sample certificates of completion, if that's something that you need. And there's also sample evaluation approaches, including pre-post test forms are there for adaptation and modification as required. And there's also signposting to additional resources, again, informed by lessons from countries. Next slide. So just to conclude, really, when we think about sustainability, all of what's been shared has driven the development of this manual to support the planning, the engagement, getting the right people involved and delivering a training session. And I think just to recap, as I conclude my session, it presents in one place all together all the materials required for an ongoing training on the current recommendations in the Practical Guide 2.0. And if we move on to the last slide, just thank you for your time. We look forward to any questions you might have this, and we will be launching this, as you'll hear, during the late summer, and translations will be available as well in due time. Thanks, and back to Arabella and to John.
Thank you so much, Julie and Arabella, for sharing these updates. This is really exciting. These look like game changers and really helping us getting from point A to point B in terms of improving WASH and IPC. There have been just a couple questions in the chat room, and thank you, Maggie Montgomery from WHO for jumping in and answering those. Jacques from Mali was asking about documents being available in French, and the French version will be coming soon, to be followed by Arabic, Spanish, and Russian. And Siddiqui again from Bangladesh is talking about finding viable, feasible, and effective methods for advocacy. And so Maggie was reflecting that examples from countries where we're using data and showing results with Washfit can be very convincing advocacy tools at the national level. So thank you very much for that. There was a question from Mandletu, I'm sorry if I'm not pronouncing your name correctly, about an e-course. Is there any kind of a plan for having an e-course on Washfit on platforms such as Agora? Arabella, would you like to take that one?
Sure, yeah, thank you for that question. So at present, we don't have a specific e-training course. However, we do have recordings of some past webinars and Washfit training sessions available on our Wash in Healthcare Facilities YouTube channel. So if you go onto YouTube and you search Wash in Healthcare Facilities, you should be able to find all of those resources. So although not an official training program, that might hopefully be useful in the meantime. We also have on OpenWHO a number of modules related to Washfit, which may also be useful to you. So OpenWHO is, as the name suggests, an open platform for training modules, and there's modules on every topic, related to COVID, to antimicrobial resistance, to IPC, and there's currently modules on available on hand hygiene, environmental cleaning, and healthcare waste in healthcare facilities, and we're looking to create a module on water and also on sanitation, so to cover the 5 main WASH domains. So that will be coming in due course. So hopefully that will help with your needs.
Great, thanks for that, Arabella. If you have any questions for Julie and Arabella, please don't hesitate. If you'd like to share some experiences that you have, something that one of the speakers has said has resonated with you and you'd like to share it, please drop it in the chat room and we'll also call on you. We do have a couple colleagues here from WHO. If you would like to share your experiences, please don't hesitate. I'm advised that Akosua from WHO Ghana may have some interesting things to share, some insights, as well as Devi from WHO in Indonesia. If you would like, please unmute and share your experience. Okay, well, we're lining up a few more people to ask questions or to share their experiences. Maybe Arabella, is it the moment just to give this summary of what are the next steps with the Washfit updating process, and then while you're doing that, maybe some people will come up with some things they would like to share or ask, and we can come back to this idea about the community of practice and how we go forward.
Yes, super. And please, everybody, don't be shy. We'd love to hear from you. So I may call on a few other names that I see. So yeah, we'd like this Washfit community of practice to be, an informal way of sharing experiences and keeping the conversation on Washfit going, because I know that there's lots of rich experience to share. So just in terms of the process. So we're here at the beginning, the Washfit meetup. We will be sharing the draft tools in July, and those are the list of tools that I shared. So the Washfit guide, the assessment form. We will probably not have all 5 technical fact sheets ready to share, but we'll probably have the first one on climate resilience available. And as Julie mentioned, the training manual will be shared later in August. We then, so as we'll be sharing those draft tools and looking for Washfit, people with experience of using Washfit, so implementers, implementing partners, WHO and UNICEF country offices, ministries of health who have experience using the tool. We'd love to hear your feedback. So is the new guide useful? Is there anything missing? Any other guidance that you would find useful? How can we as WHO and UNICEF support you to use Washfit in your current settings? So that consultation will go throughout July and August. And then we will be revising the guide and sharing the final draft ready for use. We'll also then be going through we'll be doing the layout and publication towards the end of this year or early into next year. But importantly to note that while we are working on revising the guides and these various tools, that implementation doesn't need to stop. And I have received a number of requests from partners who have heard about this new guide and said, oh, okay, when is it? We're waiting to start on a new project because we're waiting for the new guide to come out. The fundamental methodology of Washfit isn't changing. So the new products that we're launching are just designed to, if you like, clarify and make things a bit clearer for you all as the user. But there's not such fundamental changes to Washfit guide that it needs stop anyone from undertaking any implementation efforts. So if you're interested to contribute to the review process, we will share, we'll be sharing the details via our Washington Healthcare Facilities newsletter. So please do watch out for that in your inboxes. If you don't receive it already, you can sign up on the Washington Healthcare Facility Knowledge Portal, which is www.washinhcf.org. Okay, so that's the general process. I also wanted to just share the link here, and I'll copy the link into the chat box so that you can access it more easily. We're aware that there's lots of people, for example, in this community of practice who are already using Washfit, and we often hear news of a new country that's using Washfit or a new partner that started using it. We at WHO and UNICEF would like to better capture who's using Washfit, where they're using it, how, and also what the impact of the Washfit implementation has been. And we also want to know more about what are some of the challenges you've been facing, what are some of the success factors. So have you managed to make improvements in the facilities you're working in? And if so, have those been sustained over time, and what's enabled those to be sustained? So we have an online version of the form, which we'd encourage you to use, as it will make our life much easier for the data analysis. And as I said, I'll put the link to that form in the chat box. There's also a Word version available on the Washington Healthcare Facilities Knowledge Portal, which you can download, complete, and then share with us at the Washington HCF email. So as I said before, we look forward to learning more about what you're all doing with Washfit, how you're using it, and how we can also better help you with implementation efforts.
Thanks a lot, Arabella. If you return to the process slide, we had a question from Ali So about, he's asking about the time for training on the new guide. So is there any foreseen orientation and training on how to use this new Washfit guide and or the new training manual that Julie had presented?
Yeah, thank you, Ali. That's a good question. We hope that the new guide will be fairly self-explanatory. So it should be that you can pick up the guide and you can use it. It walks you through all the Washfit steps. So how you do each of the 5 steps within the facility, but also how you prepare to start Washfit, and how you also can follow up at the national level, and how you use information and data collected through Washfit to inform resource allocation and prioritization. That being said, I think as part of this community of practice, once the manual is in a more developed state, then I think we will have another one of these sessions, and we can go through the guide in a little bit more detail. So I think, yeah, we are happy to help arrange that and provide support. There's no specific national, regional or global trainings planned, but there are a number of countries who have ongoing Washfit efforts, and we're happy to help advise on how best to run those trainings if we can.
Thanks, Arabella. That's really useful. And thanks to Claire Kilpatrick, who added that the slide set associated with Washfit training manual package has a module on the methodology, which provides training on how to use the whole guide. And so these slides will be updated in the coming months that are going to be reflecting that new guide. Thanks a lot, Claire. We had some input from Devi in Indonesia. That WHO and UNICEF are also working with some partners such as Plan and SNV for the implementation of Washfit, and advocating at the central level and with local government to adopt this approach. And so far, it's been done in more than 200 primary health centers. Excellent to hear. And we also have some sharing from Mali, from WaterAid and World Vision, and very soon UNICEF. They're supporting the implementation. And to answer Maggie Montgomery's question on, what is the biggest challenge in implementing Washfit from the global partners, and how could we help you to overcome this? So one challenge which was mentioned from WaterAid, World Vision, and UNICEF is how to adapt Washfit to small healthcare facilities due to the qualification of the workers who are there engaged with the Washfit team and the Washfit process. Adapting to small healthcare facilities, Arabella, is that something that the new update is going to take into consideration?
Yeah, so Washfit is is primarily designed for use in small healthcare facilities. And we do have some updated guidance in there about who are the types of people in a healthcare facility that should be involved in the Washfit process. So in a small facility where there's limited staff, potentially limited capacity to undertake Washfit, we advise that facilities work with the local district health office and health teams, and also community representatives where applicable. There's also guidance in the facility, in the updated assessment tool about the indicators and which ones are the most important ones for the smaller healthcare facilities, because as I mentioned previously, there's a fairly long list of indicators, and they're sort of designed a bit like a shopping list, so you can pick and choose according to what your priority is. So if you're particularly focused on climate resilience or in gender and equity, then you choose those relevant indicators. But for the smallest facilities who have limited capacity, trying to assess and improve all of those indicators can seem overwhelming. So we have named them, divided the indicators into two categories, so essential indicators and advanced indicators. And the essential indicators are ones that any facility, regardless of its size, should be able to assess and address over time. And then those advanced indicators are sort of an optional add-on if there's the capacity or the interest for a particular area to be addressed. So I hope that answers the question.
Great, thank you very much, Arabella. We see there's a hand up from Guy Mabayu. I'm just going to ask you to unmute yourself if you'd like to ask your question or share your experience.
Thank you, John. It's a question on the slide that we have there on the process. We already have discussion to see how to organize a meetup in French. That's great. I believe it will address some of the questions that were raised in the chat earlier on. Now, my concern is on the public consultations that is scheduled for July to August. We know several French-speaking countries are effectively implementing Washfit since a number of years now. So I believe it will be important to make a conscious effort to have held all those paperwork in French in order to catch the flow and harvest the flow of input from those countries. So it was actually a call to my colleague to make sure that we don't leave out for those consultations the French-speaking countries. Thank you.
Absolutely. Thank you so much for raising that point. That's definitely something which is high on the priorities. Arabella, would you like to speak to that point at all on a French consultation? If we could do some rapid translations.
Yes, so yeah, thank you, Guy. That the point is very, very well taken, and we know that there are a number of Francophone countries using Washfit. So Niger, Mali, Chad, Guinea, DRC, and I know that they have a lot of valuable experience to share. So it's the problem that we always have about getting the resources into other languages as quickly as possible, and it's a bit difficult to go through the translation process before we finalize the version. I think at the very least we're going to work on getting the assessment translated into French, and we can share that to make it for Francophone colleagues to review and provide any comments. And we will do our best to get the rest of the materials translated as quickly as possible. We'll also look to hold a webinar in French for our Francophone colleagues in the coming weeks to at least give them an update of these new products and provide an opportunity to share some experience that way. So over to you.
Thanks, Arabella. Michael from GIZ commented that the biggest challenge is to serve the interfaces of WASH with other sectors like waste management, and safe water supply is an issue as many healthcare facilities don't have a direct connection, and boreholes are expensive and difficult to maintain in the long run. Absolutely. This hardware solutions and having the right combination of solutions to enhance the WASH services is something that, at least if we know the priorities through tools like Washfit, then we can see how to go about making those solutions. I'd like to ask if Maggie Montgomery, if you'd like to come in here, share some insights and also some other perspectives that may be resonating with you.
Great, thank you, John, and really wonderful to hear so many different experiences. And I always learn every time that I engage in these Washfit conversations. I think just two things. I mean, one is that this tool, probably unlike other tools in the wash sector, is really meant to be kind of, ripped apart, restitched together, depending on the health needs and the health collaboration. So really, and it's great to see many health sector individuals' names that I recognize on this call, but really encourage you to think about how this tool can also, be used as part of quality improvement efforts or AMR efforts or outbreak efforts. And that's just one thing that I wanted to point out. And I think the second point that I wanted to point out is this, these improvements and these updates are really meant to be for the users and to make it as easy and as Julie emphasized to make the journey quicker and faster and especially to support national scale up and both the bigger infrastructure investments as well as all the day-to-day investments and we know both are equally important. And the recent costing exercise at WHO and UNICEF finished at the end of last year for WASH and healthcare facilities in the least developed countries found that the O&M, those daily costs, are actually about 2/3 of the overall cost. So it's really important, and we believe that this Washfit tool is primarily an important tool for that. So I'll stop there. I just really encourage you to continue to engage. Thank you for all your hard work and look forward to your inputs, not only on the updated materials, but how we continue this conversation together. So thanks, John. Thanks, everyone.
Thanks a lot, Maggie. Thanks for those points. Very inspiring. And Arabella has just posted a link in the chat box for sharing your experience of implementing the new survey. So you can visit that and have a form that you can complete. In the meantime, we had the colleague from Ghana, Asokua, who said that in Ghana, WHO and UNICEF are working together on Washfit. They've done trainings, and particularly for the quality of care for maternal and child health initiatives. So they're integrating the WASH indicators in their own assessment tools for maternal and child health initiatives. And during the COVID-19 pandemic, they used the tool to assess WASH services in treatment centers. And so this is, the government of Ghana has some trainings planned, and the new tools will be very useful. Excellent to hear. And Devi from Indonesia added that the beauty of Washfit is that we can modify the indicators according to the local context. And I think that's something that had already been starting to happen, had been happening a lot, but this is really going to facilitate that process of contextualization and making it a really, really useful tool from the local perspective. So in Indonesia, you've modified the indicators and you've added indicators where you found that they were better corresponding with what the needs of the national health system were. Fantastic. Well, Arabella, is there anything else that's coming up in the chat room that you would like to address? Any other thoughts people would like to raise their hands?
I'm just looking back through the chat box at the moment.
Do you see a hand from Siddiqui?
Oh yeah. Please.
Go ahead, Siddiqui.
Okay, so thanks, John, Arabella. This is Siddiqui again. I just have a very quick question for what I'm a bit concerned about. That is, currently we are thinking of rolling out another phase of Washfit, especially in the Rohingya refugee camps. But the problem is, considering the current situation and like the massive government lockdown, it doesn't seem easily possible to organize any Washfit training for the healthcare facility staff, because healthcare facilities are like in the more risky zone. So what I was thinking, if WHO or UNICEF or like the global community of practice, if they have any plan to introduce something, online training, which is maybe a shortened version or a modified version to like keep continuing the Washfit training for the healthcare facility staff. Because It's true that we have to respect the lockdown situation or containment, but at the same time, like the software components from Washfit, that is also necessary for countries like Bangladesh, with like who is a like a resource poor country. So, you have any such plan to develop any online version of Washfit? Thank you.
Thanks, Siddiqui. Arabella or Julie, any thoughts on that?
Yeah, that's a very good question, Siddiqui, and one which we have see there's been a number of countries in a similar situation where movement of people is restricted, so we haven't been able to run face-to-face training when we otherwise might have. One good example of that is Indonesia, and our colleague Devi from WHO Indonesia is on, may have some particular experience to share, and Debbie, please feel free to raise your hand and unmute yourself. There in Indonesia, we adapted the training material specifically for a virtual audience. And the new training manual and the training package, the training slides have adaptations integrated on how you can better deliver the training materials in a virtual world. So what are the types of breakout room exercises you can do, and some other suggestions for making it more interactive for the virtual audience. One of the main limitations by doing a virtual training is that normally in a face-to-face training, we would have all the participants go and visit a healthcare facility, take the Washfit assessment tool, do a walk around the facility, test out the assessment tool, and come up with a sample plan for Washfit. Obviously, that's not possible when there's lockdowns. So in Indonesia, we filmed a video of a tour around a healthcare facility, and we used that as part of an interactive exercise where hypothetically we developed a Washfit improvement plan for that facility. So that's something that could be encouraged. If you're able to visit at least one facility, you could do a recording of the facility and interview some facility staff, and then use that as the basis of your Washfit training and your kind of group exercises. Over to you, John.
Great, all kinds of creative solutions, and working together in a community of practice would be a great place to have these kinds of exchanges. So before we go to Irene from UNICEF for some closing remarks, Arabella, there's just one more question. If you have 30 seconds, when is guidance on integration of Washfit and climate change resilience in healthcare facilities available? This is a question from Ngia Ton.
Thank you very much, Nia. Yes, so in the Washfit guide, there is more, as I mentioned, more guidance on climate resilience in healthcare facilities, and there's going to be one of the fact sheets dedicated to this topic, so focusing on those improvements that facilities can make. WHO does already have existing guidance on improving climate resilience in healthcare facilities, and perhaps one of my colleagues can add the link to that in the chat box. That's available on the WHO website. We also have a dedicated module in the training package specifically on climate resilience. So that also should help support. And then lastly, we do know of a number of countries who have already developed specific guidelines on climate resilience. And as and when we learn of other countries who have developed similar guidance, we upload them onto the knowledge portal. So if you go onto the resource section and search for climate resilience, you should find related documents that might help in your own countries to develop similar guidance or support you in your climate resilient efforts.
Thanks, Arabella. Well, this has been very rich, and I'd like to hand over to Irene Amungan from UNICEF. Irene, you were in Kathmandu. We first met in 2017 when at that global workshop or conference on WASH and healthcare facilities. We were just seeing a prototype version of Washfit. We were looking at different options for how to introduce it, and then you have been very much involved in the 2018 publication of Washfit. I'm really pleased to hand over to you for some closing remarks and maybe way forward. Thank you.
Thank you so much, John. Thank you, Arabella and everyone. Yeah, John, we met, I think we've met a couple of times now at UNC, and yeah, so thanks and great to meet you again. Good morning, everyone. Good afternoon and good evening, wherever you are. On my own behalf, first of all, and on behalf of UNICEF and WHO, let me start by thanking you all for participating in this important webinar and for contributing to the discussions here. I think your ideas and insights are always invaluable. So we really appreciate your contributions, and we hope that we can have more of these kind of webinars just to learn from one another. I would also like to thank Arabella and colleagues from WHO and UNICEF as well for the preparations that went into pulling this webinar together. I believe, as John has said, we've learned a lot from this 1 hour webinar, just listening and hearing from colleagues from Arabella and Julie on the new tools, the guidance, the manual that is coming up to help us to implement the Washfit, but also from country experiences from Bangladesh and other countries on what they are doing in terms of implementing the Washfit. So I think it's just good to hear these experiences, because we learn a lot, but also they motivate us, especially for us who may not have started to use this tool in our countries. And so you can see what's happening in other countries and apply to your own context as well. So I think the presenters have taken us through quite a lot, and I'm not going to repeat that. But I just wanted to emphasize what Maggie said. I think, you know, when we talk about the Washfit, we're not just talking about implementing Washfit to improve wash services in healthcare facilities. Of course, that's one of the reasons. But I think the most important thing is really to look at the end goal. What are we really aiming to achieve by improving wash services in healthcare facilities? We are working together with health colleagues to make sure that, you know, the services we provide in healthcare facilities are of good quality, so that, you know, children, women, and newborns, as well as the other patients that receive care in these facilities, can receive good care, and they can receive good quality care, and that they can, you know, survive the sicknesses, the ailments, you know, the infections. They can be able to fight off infections in healthcare facilities and live better quality lives. So I think this is one of the things we should always bear in mind when we think about Washfit, when we think about wash in healthcare facilities. Now, a good number of countries, like Arabella mentioned, are implementing the Washfit. Now, I think we have about 40 countries or so since the Washfit was launched way back around 2015. But I just wanted to say that we would like to see more of the countries. We have over 200 countries in the world, and you know that washing healthcare facilities is not just an issue for poor healthcare facilities or even LDCs, the less developed countries, but also middle income countries. So we'd like to see more of the countries actually implementing the Washfit and seeing all of the healthcare facilities around the world using this tool to make sure that wash in healthcare facilities is improved. And with your support, I think that we can make this possible. We can reach more countries, we can reach more healthcare facilities. And this is very important because we are counting only 10 years from now before we reach the SDG period. And I think acceleration is very important at this point for us to be able to reach the SDG targets on universal health coverage, but also on reaching all healthcare facilities, but also all places with wash coverage. And I think the tools that we have now that we are developing with WHO with support of some of the partners are really important to help us reach these targets. So there is no doubt that the tool can help us achieve greater success. We heard from several countries, but also from Arabella, I think, on Laos and Mali, which have used the tool. They have adapted it already, including climate resilience. And I think you can see that already those countries are sharing what they have been able to achieve in terms of increasing coverage, but also improving the quality of services in healthcare facilities. So I just wanted to urge all of us here on this call to promote and support the use of this tool, because we know that it can make drastic changes in a healthcare facility. And I hope that we can apply what we have learned today from this call in our respective settings. So without taking more of your time, I just wanted to end here by saying that each one of us has a role to play. Each of the organizations, each of us individually can play an important role. It takes careful planning, supporting governments to plan, but also helping governments to make sure that they allocate resources to implementation of the Washfit, because we need the resources to implement the tool. We need staff to implement it. I think somebody on the call mentioned that in healthcare facilities that are very small, sometimes can be challenging. And I was thinking about what this kind of challenges might be. It might be that there are very few staff in these healthcare facilities, and they may not be able to support adaptation of this tool. It might be in terms of, maybe the understanding of the Washfit itself. And so such facilities need to be supported to train them to understand, but also to use the tool effectively. So it takes resources, it takes financial resources, human resources, operational resources, but also it takes leadership. Somebody talked about leadership. It takes commitment from the government, from the Minister of Health, from the district or regional health persons, but also it takes really working together. We can't achieve this individually. We need to work together. And I'm happy that we are here together from different organizations for this common cause. And just to say that, each one of us have something, that we can come with. We have different comparative advantages from our organizations. And I think that's the beauty about working together, that we can come with different strengths to support the implementation and adaptation of this tool to scale up wash services in healthcare facilities for a smooth and sustainable implementation. So at UNICEF, we are actually engaging with some of our countries now and regions to create capacities on Washfit in different countries. And we are in the process of identifying these countries. And so we want to provide training to these countries. And most of these countries will be countries where really wash services are poor in healthcare facilities. And so we want to create capacities on Washfit implementation to help them scale up wash services in healthcare facilities. And so I'm really looking forward to working with some of you. I think Fabrice is on this call, and he's the person who will be supporting us from UNICEF side to conduct this training at the country level. This training is going to be online, so it's not a face-to-face training. It's going to be online, and so we hope that with this kind of training in countries, that these capacities can then help us to even train more people, more healthcare facilities on Washfit implementation and improve services over time. So I think that's what I had to say for now. Again, to say thank you so much to everyone for contributing to this important webinar, and we hope we can connect soon again. Thank you so much. Over to you, John.
I think that says it all. Thanks a lot, everyone. Have a wonderful evening. See you next time.
Goodbye. Thank you, everyone. Bye, John. Bye, Arbella. Bye, Reed. Bye, everyone in the field.
Bye. Bye.
Bye. Good luck.
Bye.